today, so I'm thankful for his contributions. A number of bills today continue the important work of the committee to support moms and children. For example, the Accelerating Kids Access to Care Act will make it easier for children enrolled in Medicaid to get the important specialty care they need. Dr. Miller Meeks has been a leader on this legislation, and we've heard testimony from Iowa Children's Hospital of the needless and detrimental delays in care due to red tape. The bill is even more important now with exciting innovation in cell and gene therapies that could cure children with sickle cell and other rare diseases, but potentially require children to travel across the country. Next, the Shine for Autism Act, which passed this committee and the House floor overwhelmingly last Congress. This is the second piece of legislation that we've moved to help prevent the heartbreaking tragedy of stillbirth. I want to share a special thanks to Debbie Hain, who's in the audience today, for her steadfast support and dedication to raising awareness on stillbirths for over a decade. This bill is named after her daughter, Autumn Joy, who was born still on July 8th, 2011. And we are honored to remember Autumn today and to thank Debbie for her tireless advocacy. In addition, my friend Representative Chris Smith has for decades led the effort for more research into autism and the best ways to support the entire population of individuals with autism and their families. The latest reauthorization of the Autism CARES Act, which I'm proud to support today, continues important HHS-wide programs to further these goals. We will also move Representative Olbernolte's HOLD Act forward to further support living organ donors who give the miraculous gift of life to patients in need. And while not included on today's agenda, reauthorizing the Pediatric Rare Disease Priority Review Voucher Program at FDA ahead of its September 30th expiration remains a top priority. Patients with rare diseases and their families continue to push for action. And by continuing to work together, we can pass it out of this committee with broad bipartisan support. We're also voting on 4 bills to improve program integrity in Medicaid. Bills from Representatives Bill Arakis, Miller Meeks, D'Esposito, and Garcia will reduce the rate of improper payments by ensuring that only current living beneficiaries are enrolled in Medicaid and only legitimate providers participate in the program. Bills that require timely disenrolling of deceased beneficiaries from Medicaid may seem obvious, but the Office of Inspector General continues to find it is an issue. I'm glad these members have prioritized being good stewards of Medicaid funds. And finally, I want to highlight the work of the committee as we continue to help seniors access health care. This committee led on site-neutral reforms as a part of the Lower Cost, More Transparency Act to make sure seniors paid the same out-of-pocket for drug administration, regardless of whether it was administered in a hospital or a doctor's office. During COVID-19, seniors were able to get specialty medications directly from their oncologist, but this is no longer the case. Ms. Harshberger's legislation will reestablish this option for seniors for another 5 years, and will continue to work to improve access to telehealth in Medicare. Mr. James' legislation will ensure program integrity measures are in place so that we can more effectively see how telehealth is working for patients on Medicare. Ms. Steele's legislation will make telehealth more accessible for patients with limited English proficiency. I'll note members and our staff continue to work on a fully paid package to extend telehealth flexibilities for seniors and include additional priorities on diabetic and cardiac care. I'm optimistic we'll be able to move the package before the August recess and well before those authorities expire at the end of the year. I want to thank all the members for their hard work on these bills and taking the time necessary to get the policy right and move policies in a fiscally responsible way. All of the legislation today that increases spending in Medicare or Medicaid is offset with reductions in Medicare or Medicaid spending, and I'm proud of all that we have and continue to accomplish when we work together. I yield back. I now recognize the gentleman from New Jersey, the ranking member, Representative Pallone, for 5 minutes for his opening statement.
Thank you, Madam Chair, and thanks for all your efforts to achieve bipartisan bills today. The committee is marking up 13 bills, all of which have bipartisan support, and we'll begin by considering a few bills to strengthen our public health programs. I'm pleased we're advancing legislation championed by Representative Boyle, who will allow HHS to evaluate this bill will allow HHS, I should say, to evaluate existing research on women and underserved populations and correlations to lung cancer. And this bill is important because it allows scientists and policymakers to identify opportunities to accelerate research in this area and develop a public awareness campaign on lung cancer screening to better reach underserved populations. I'm also pleased we're advancing the Shine for Autumn Act led by Representative Castor on the Democratic side. This legislation was spearheaded by Debbie Haynes, who I understand was originally from my district, and the purpose is to give meaning and purpose to the tragic loss of her daughter, Autumn, and it's going to put a needed focus on preventing stillbirths through enhanced data collection, research, education, and awareness. This bill is the beginning of a long-term solution to reducing stillbirth rates that tragically affect many families. Next, we'll consider a bill to strengthen the Medicaid program. I'm pleased we'll consider H.R. 4758, the Accelerating Kids Access to Care Act. And this bipartisan bill streamlines the process for out-of-state pediatric providers to enroll in Medicaid so that children who need specialized treatment outside of their home state can access that care in a timely manner. And I want to thank Representative Trahan for her leadership on this bill, and I hope that it'll bring some peace of mind to the families of children who face unnecessary and devastating delays in getting the care they need. We'll also consider a bipartisan amendment to the Accelerating Kids Access to Care Act that includes a prohibition on spread pricing in Medicaid. Spread pricing occurs when pharmacy benefit managers keep a portion of the amount paid to them for prescription drugs instead of passing those payments on to pharmacies. And this practice unnecessarily drives up pharmaceutical spending. Banning spread pricing in Medicaid was part of the bipartisan Lower Cost, More Transparency Act passed by the House in December, and I hope that it can soon become law. I'm also pleased that we'll consider 4 bipartisan Medicaid program integrity bills, including H.R. 8111, which will require states to collect beneficiary address information from Medicaid managed care plans. And this simple policy will help state Medicaid agencies stay in better contact with beneficiaries to renew their eligibility, while ensuring that beneficiaries who no longer live in the state do not remain enrolled in the program. Then there's H.R. 8084, the Live Beneficiaries Act, that requires states to more regularly check Social Security Administration death records, ensuring Medicaid is not making monthly payments to managed care plans for beneficiaries who have passed away. Now, turning to Medicare, I'm glad we found a bipartisan path forward on H.R. 5526. Congress enacted the Physician Self-Referral Law, also known as the Stark Law, to ensure that physician financial considerations do not influence patient care. Under the Stark Law, physicians are prohibited from making referrals to entities in which the physician has a financial stake. Medicare beneficiaries deserve the independent judgment of their physicians and access to treatment that is medically appropriate and necessary for them, and the Stark Law is critical in ensuring that financial arrangements do not distort physicians' decision-making or raise health care costs. And while I have strong concerns with weakening the Stark Law, I believe there are limited instances in which it may be necessary for a caregiver or a family member to pick up prescription drugs for patients or for prescription drugs to be mailed, which is currently prohibited under the Stark Law. I believe this narrow Stark exception would help patients receive necessary medications but still protect Medicare beneficiaries by ensuring that provider decisions are made on the basis of clinical criteria. So I'm pleased we're able to include additional guardrails to ensure that patients have access to treatment and care that is based on medical necessity. I'm concerned that some technical assistance provided by CMS has not yet been incorporated, but I understand that Chair Rogers is committed to work with me to address the agency's feedback before the bill is considered on the House floor. So I'd like to thank the Chair, again, for this truly bipartisan process and for only moving forward on bills with bipartisan support today. There are other health priorities, including telehealth, that just were not ready for today, but I look forward to continuing to work together on these outstanding bills. And with that, I yield back, Madam Chair, the balance of my time.
Gentleman yields back. Chair reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Chair recognizes Mr. Guthrie for 5 minutes.
Thank you, Madam Chair. Today's full committee markup represents another important step to ensuring Americans receive the highest quality and the most affordable health care they need. Today, we're marking up legislation to provide greater access to life-saving care for kids, access to critical telehealth services for our seniors, address critical program integrity issues in the Medicaid program, and provide access to care for vulnerable populations. I would like to thank all the Health Subcommittee colleagues and the staff for advancing these bills to the full committee and for the bipartisanship on such important issues. Specifically, I'd like to thank Representatives Miller Meeks and Bilirakis for their bipartisan work to address program integrity issues in the Medicaid program. We also have legislation, the Honor Our Living Donors Act, that will help patients in need of a transplant gain access to potential donors by making common sense reforms to the current program. And while we're not addressing the more major bills or comprehensive bills on telehealth today, we do have some bills on telehealth, and thanks to Representative James and Representative Still for leading these important bills to help seniors struggling in behavioral health care needs, in addition to making telehealth more accessible to non-native English speakers. And I know there's work to continue on the more comprehensive telehealth bills and the pediatric priority review voucher. Look forward to that work. Mr. Bilirakis and SU are continuing to work on legislation for the pediatric priority review and make other important changes for rare disease drug development that we heard testimony in this subcommittee on Rare Disease Day. I look forward to discussion today and yield back.
Gentleman yields back. Are there further opening statements? Chair recognizes Ms. Eshu for 3 minutes for an opening statement.
Thank you, Madam Chairwoman, and good morning, colleagues. Today, as the members have said, we're considering 13 bills. First, we'll consider several bills to make the Medicaid program more efficient by ensuring enrollment information for physicians and patients is up to date. Second, we'll consider the Shine for Autumn Act, legislation introduced by Congresswomen Castor and Kelly to close gaps in stillbirth data, research, and awareness to ensure that all moms have healthy babies. Third, we'll consider the Women and Lung Cancer Research and Preventive Services Act, legislation to move the needle on the alarming increase of lung cancer diagnoses among young women who have never smoked by commissioning more research on prevention and treatment. Unfortunately, we haven't reached bipartisan agreement yet on my legislation, the Innovation in Pediatric Drugs Act. I plan to continue bipartisan negotiations with you, Madam Chairwoman, and our ranking member, Mr. Pallone, and Congressman Bilirakis to identify an offset or a workaround to accommodate increased funding for the NIH Best Pharmaceuticals for Children Act program. The program is critical for studying new uses for drugs to treat children once the drugs lose their patent protections. I appreciate and thank the chairwoman, our ranking member, and Mr. Bilirakis for working with me on this important issue. It's hard to find an agreement, and I thank you and your staff for working closely with myself and my staff to get the legislation to where it is today. And where we are today, I believe, is very close to the finish line. I look forward to finding, as I said, a bipartisan solution. I applaud the work that's gone into the bills that are before us, and I look forward to this productive market, and I yield back.
Gentlelady yields back. Further opening statements. Chair recognizes Mr. Bilirakis for 3 minutes for the purposes of offering an opening statement.
Thank you so much, Madam Chair. I'll be brief, but I want to reiterate our commitment to work towards a strong bipartisan resolution on the pediatric rare disease package we put together at subcommittee under the Give Kids a Chance Act. While I'm disappointed that we couldn't consider that legislation here today in the full committee markup, I remain optimistic that we will be able to notice and vote out as strong of a bipartisan showing as possible in the next markup we schedule. I'm fully committed to continuing to negotiate and work out an agreement with my friend and colleague, Representative Eshu, and I know we're very close to doing that. So I want to thank her for her good faith efforts thus far. I know we both care about this issue greatly, and I want to ensure we are incentivizing new treatments and cures for children with rare diseases and cancers. We must move forward quickly to reauthorize the rare pediatric priority review voucher, which expires in September. I know we're going to get it right. I also want to thank the fellow co-leads on that bill, and that's Representative Trahan, Barragan, and Burgess, for their steadfast support and commitment to get this across the finish line. In the interim, we have great policies on the agenda today, including the Accelerating Kids Access to Care Act, the SPEAK Act, and Shine for Autumn Act, among many others. I thank the chair and the ranking member for putting together this markup, and I look forward to supporting all these bills out of committee today, and I'll yield back the balance of my time unless somebody wants it. Thank you. I yield back.
Gentleman yields back. Further opening statements? Seeing none, the chair calls up H.R. 6020 as amended by the Subcommittee on Health and asks the clerk to report.
H.R. 6020, a bill to amend the Public Health Service Act to eliminate consideration of the income of organ recipients and providing reimbursement of expenses to
Without
donating.
objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? Chair recognizes Mr. Obernolte for 5 minutes to speak on the bill.
Thank you, Madam Chair. Move to strike the last word.
Gentleman's recognized.
Thank you, Madam Chair. It's an honor to be able to speak in support of my bill, H.R. 6020, the Honoring Our Living Donor Act. I think we can all agree that one of the most selfless acts that someone can commit is the donation of an organ to someone else, and yet it happens thousands of times each year. In fact, in 2022, nearly 6,500 lives were saved through the donation of an organ by a living donor. And yet, there is a desperate need for more of these donations. There are currently more than 100,000 Americans on the waiting list awaiting a transplant. And in 2021, 6,000 people in the United States died while waiting for a transplant. Between 2006 and 2021, the list of Americans waiting for a kidney donation rose by over 50%, but unfortunately, kidney donations declined by 7%. And this year, over 100 Americans are added to that waiting list every single day. And the reason for this is that it is a huge commitment to be a living organ donor. In addition to the medical commitment, the typical living organ donor spends over 10% of their annual income just to be a donor. On average, they have to take 2 weeks off of work. It's 6 weeks off of work if the work involves physical exertion. And it's a huge burden on these people. So we want to make it easier for people to be living organ donors. In 2007, Congress established the National Living Organ Donor Assistance Center, which provides assistance financially to donors who make less than 350% of the poverty line. However, that means test is applied not only to the income of the donor, but also to the income of the recipient, which is actually pretty nonsensical and has resulted in many people who would be eligible for assistance to not be eligible for that assistance. This bill, H.R. 6020, would correct that problem by clarifying that the means test applies only to the donor and not to the recipient of the organ. Hopefully this will incentivize more people to take the selfless step of becoming living organ donors and get those organ donations back up to where they're more meeting the need. I'd like to thank Congresswoman Susan DelBene for her work on this bill and for co-leading the bill with me. This is a common sense bill that passed out of subcommittee unanimously. I'd respectfully request your support on the bill. I yield back.
Gentleman yields back. Further discussion? For what purpose does the gentlelady seek recognition?
Madam Chair, I move to strike the last word.
Gentlelady is recognized for 5 minutes.
I'm glad to see the committee taking up legislation to address the shortage of available organs for transplant. I support the HOLD Act, and I'm confident it will save lives. But we still have a lot of work left to do to address the national organ shortage. Every day, 17 Americans die waiting for an organ. Americans we could save with updated public policy. We need bold action to prevent this needless loss of life. That's why at the start of this Congress, I introduced the Organ Donation Clarification Act, which includes language to ensure more potential donors are eligible for federal support. This language is mirrored in the HOLD Act, which I'm supporting today. Beyond the language before us today, my bill would ensure potential donors would receive the comprehensive support they need to be able to donate. It would also allow for the testing of new and innovative technologies or methods to increase donations. Today, there are over 100,000 patients waiting for a kidney. Most of them will never get one. This is a national crisis. To meet the magnitude of this crisis, we must do more. We should pass the HOLD Act today, and I hope this committee can continue to work on this issue, including by taking up my Organ Donation Clarification Act. I yield the balance of my time.
Gentlelady Ms. Matsui yields back. Further discussion? Question now occurs on approving H.R. 6020 as amended, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Kamek. Kamek votes aye. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eshue. Eshue votes aye. Deget. Deget votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Ruiz. Ruiz votes aye. Peters. Dingle. Vesey. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Rogers.
Aye.
Rogers votes aye.
Oh. Madam
Mr.
Clerk?
Card-
Yeah. How's Mr. Cardenas?
Cardenas votes aye. Ms. Dingle's not recorded. Dingle votes aye.
The clerk will report.
Chair Rogers,
Madam Clerk, how is Mr. Vesey recorded?
Mr. Vesey is not recorded. Vesey votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 42 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 455 and asks the clerk to report.
H.R. 455, a bill to amend the Controlled Substances Act to fix a technical error in the definitions.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? Question now occurs on approving H.R. 455, an and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Curtis. Curtis votes aye. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eschew. Eschew votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes.
Aye.
Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Dingle. Dingle votes aye. Vesey. Vesey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Barragan votes aye. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Clerk will report. Oh, Madam Clerk, how's Mr. Peters recorded?
Mr. Peters is not recorded.
Oh.
Peters votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 44 ayes and 0 noes.
The ayes have it and the bill is adopted. Chair calls up H.R. 4534 as amended by the Subcommittee on Health and asks the clerk to report.
H.R. 4534, a bill to require a review of women and lung cancer and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point so ordered. Does anyone seek to be recognized on the bill? For what purpose does Mr. Ruiz seek recognition?
I'd like to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Chairwoman. According to the CDC, lung cancer is the third most common cancer in the United States. While the number of new lung cancer cases is decreasing, more work needs to be done to reduce barriers to preventative screenings and innovative treatments. We need to address the disparity in lung cancer cases between men and women so we can save more lives. That is why this bipartisan bill, H.R. 4534, the Women in Lung Cancer Research and Preventative Services Act, that I co-sponsored, is so important. And I would like to thank my colleagues, Rep. Lisa Blunt Rochester and Rep. Boyle on Ways and Means for their work on this legislation. This bill would require HHS and the Department of Defense and the VA to collaborate on an interagency review of women in lung cancer and preventative services, as well as identify opportunities for improving research. It would also increase public awareness of this disease. So I urge my colleagues to support this bill in markup today. While it is not under consideration by the committee today, I would like to reiterate my support for another bipartisan bill that I am an original co-sponsor of, H.R. 2407, the Nancy Gardner Sewell Medicare Multi-Cancer Early Detection Screening Coverage Act. This bill would increase access to multi-cancer early detection tests for our nation's seniors, and this has life-saving potential. So I urge my colleagues to join me and co-sponsor H.R. 2407, and I urge the committee to include this bill in future markups and any healthcare package that is being worked on. Thank you, and I yield back.
Gentleman yields back. Further discussion? Seeing none, the question now occurs on approving H.R. 4534 as amended, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eschew. Eschew votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. VC. VC. VC votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Madam Clerk, how is Mr. Palmer recorded?
Mr. Palmer is not recorded. Palmer votes aye.
How's Mr. Carter recorded?
Mr. Carter's not recorded. Carter votes aye.
How's Mr. Allen recorded?
Mr. Allen is not recorded. Allen votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 44 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 5012 and asks the clerk to report.
H.R. 5012, a bill to improve research and data collection on stillbirths and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill?
Madam Chair?
For what purpose does Mrs. Lesko seek recognition?
Thank you, Madam Chair. I move to strike the last word.
Gentlelady is recognized for 5 minutes.
Stillbirth is one of the most tragic things a family can go through, and sadly, more than 60 families, must be 60 million families, feel this pain every day in the United States. But there is hope. At least 25% of these stillbirths are preventable. We just have to put the work in to get it there. I'm proud to be a co-sponsor of this bill that will increase data collection and reporting in stillbirths, provide improved fetal autopsy training to better learn about the causes of stillbirth, and more awareness and education about stillbirths, their causes, and ways they can be prevented. Although we may never completely eradicate stillbirth, we can take a big step in doing so with this legislation, so more families are not faced with the incomprehensible loss of losing a child. I urge my colleagues to support this legislation. Thank you, Madam Chair, and I yield back.
Gentlelady yields back. Chair recognizes, for what purpose does Ms. Castor seek recognition?
Move to strike the last word, Madam Chair.
Gentlelady is recognized for 5 minutes. Thank you, Madam Chair. Members, there are too many stillbirths in America today, and that's why it is so heartening that the committee is going to do something about it by moving bipartisan legislation, the Shine for Autumn Act, that I am co-leading with Representatives Kim, Kelly, and Joyce, and thanks to the other co-sponsors here. I know Rep. Trahan, Rep. Blunt-Rochester, Rep. Lesko. But I want to also particularly thank Chair Rogers and Ranking Member Pallone. You all have been consistent in your support and encouragement for this legislation along the way, including the professional staff, so thank you as well. The Shine for Autumn Act is not new to this committee. We passed it unanimously at the last Congress. Out of committee, it passed the House. We just need to get it across the finish line in the Senate because the need for action is urgent. The bill is named for Autumn Joy, who was born still on July 8th, 2011. Her mother, Debbie, has turned Autumn's tragic death into a mission to increase stillbirth awareness and education, and ultimately to decrease the number of families who experience such a heartbreaking loss. Many of you have met Debbie, and if you haven't, just know that she is a force for positive change. Thank you, Debbie, for galvanizing families across America to get Congress to act. Because stillbirth is a public health crisis in the United States, with over 21,000 stillbirths every year, almost 60 babies dying every day. That exceeds the number of deaths for children age 0 to 14 from guns, accidents, preterm births, SIDS, drowning, fire, and flu combined. And like too many other maternal and child health issues, there are persistent and long-standing disparities, with Black women more than twice as likely to experience stillbirth than white women. At least 1 out of 4 stillbirths is estimated to be preventable. But there's still so much that we don't know. That's why we need real change. We need measurable improvements for families. The Shine for Autumn Act will improve surveillance and data collection relating to stillbirth nationwide. We'll invest in research to examine the causes and risk factors. Additionally, we'll seek to increase education and awareness around stillbirth. Parents deserve better data and science. And I know that until an issue has been carefully researched, analyzed, and quantified, it is nearly impossible to take meaningful action. We need a clearer picture as to why babies are dying if we want to make progress towards reducing stillbirth rates and improving outcomes. So with timely and accurate data, we can begin to understand the underlying causes and guide policy actions and much-needed strategies for prevention. Together, our committee can address the serious maternal and infant health crisis that is tearing so many families apart and causing significant pain and trauma. And I know there are others here today who are among the 91 bipartisan co-sponsors. Thank you. Thank you for your unanimous vote last Congress. Thank you for helping us get it past the House, and talk to your senators about making this a priority too. Thank you again for your vote today to support Debbie and Autumn Joy and all the other families who have been impacted by this public health crisis. Thank you for focusing on solutions. I yield back. Gentlelady yields back. Further discussion. For what purpose does Mr. Carter seek recognition?
Madam Chair, I move to strike last word.
Gentleman's recognized for 5 minutes.
Every year, over 21,000 babies are stillborn in the United States. No family should endure such an unimaginable tragedy. The Shine for Autumn Act aims to address these alarming statistics through enhanced data collection, research, education, and awareness. Thank you to Chairwoman Rogers, Representative Kim, and Representative Castor for your leadership in bringing this bipartisan bill before this committee today. We need to pass this bill, this Congress. This is absolutely no reason this should wait. I urge all my colleagues to support the Shine for Autumn Act, so we can move this bill forward and start making a difference in the lives of babies and families nationwide. Thank you, Madam Chair, and I yield back.
Gentlelady yields back. Further discussion. Chair recognizes, for what purpose does Ms. Kelly seek recognition?
I move to strike the last word.
Ladies recognized for 5 minutes.
Thank you, Madam Chair. As you've heard, there are over 20,000 stillborn babies each year in the United States. This is a deeply painful experience for mothers and family. And what's even more troubling, according to research, nearly a quarter of these stillbirths can be prevented, with the majority occurring in low-risk pregnancies. Black women, Medicaid recipients, and residents of rural areas bear a disproportionate share of these tragic losses, underscoring the urgent need for targeted interventions and equitable access to care. These disparities in our maternity care system have profound consequences. Maternity and newborn care account for a significant portion of hospital expenditures for most commercial insurers and state Medicaid programs. With Medicaid covering 42% of births in the United States, the federal government bears substantial responsibility for ensuring the quality and value of maternal newborn care. We cannot remain complacent. We can and must do more to mitigate the risk of stillbirth and offer support to those who have suffered such a traumatic loss. That's why I'm proud to join the bipartisan Shine for Autumn Act, along with my colleagues Rep. Castor, my co-chair of the bipartisan Maternity Care Caucus, Rep. Young Kim, and Rep. Joyce. Importantly, these bills allocate funds, as you've heard, to enhance data collection, increase training in perinatal pathology, and disseminate educational materials on stillbirths. This legislation will give families a true chance to thrive and is vital for bridging research gaps. For these reasons, I urge my colleagues to once again to support this bill so that no mother has to endure the heartbreak of having a stillborn baby. Thank you, and I yield back.
Gentlelady yields back. Further discussion. For what purpose does Ms. Miller-Meeks seek recognition?
Madam Chair, I move to strike the last word.
Ladies recognized for 5 minutes.
I'm proud to co-sponsor H.R. 5012, Stillbirth Health Improvement and Education for Autumn Act, sponsored by my friend and colleague Young Kim. This legislation would authorize grants and improve data collection processes for the prevention of stillbirths. In 2021, 164 Iowans were stillborn, wreaking havoc on expecting mothers and families who wait 9 months for the joyful occasion, only to be met with tragedy and guilt and remorse. Stillbirth is possible for all pregnancies, even ones that are seemingly low risk. This legislation would create the first nationally coordinated effort to reduce stillbirths, and I'm proud to be supportive of this effort, and I thank Autumn's mom for being here with us today and championing this cause. Thank you, Madam Chair, and I yield back the balance of my time.
Gentlelady yields back. Further discussion. Seeing none. Question now occurs on approving H.R. 5012, and a roll call vote has been requested. The clerk will call the roll.
Burgess.
Burgess votes aye.
Burgess votes aye. Latta.
Aye.
Latta votes aye. Guthrie.
Aye.
Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Palmer votes aye. Dunn. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller-Meeks. Miller-Meeks votes aye. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. James. James votes aye. Pallone. Eshu. Eshu votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. VC. VC votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Badagan votes aye. Blunt Rochester. Soto. Soto votes no. Soto is off. No on aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Madam Clerk, how is Mr. Pallone recorded?
Mr. Pallone is not recorded. Pallone votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 45 ayes and 0 noes.
The ayes have it, and the bill is adopted. Good news. We will now recess the floor votes for floor votes and resume 10 minutes after the last floor vote is called. The committee will stand in recess. So far, so good. We're rocking and rolling. Grace has set it up.
She did. It's a Senate staffer for you. Everything's very baked. No one likes surprises.
Yeah.
Oh, yeah. Do you want to say
Yeah.
hi to
Yeah.
Debbie?
Yeah. Committee will come to order. Chair calls up HR 6020. Is that right? Is that what we just did? No, we did 6020. Yeah. Well. Okay, Chair calls up HR 7213 as amended by the Subcommittee on Health and asks the clerk to report.
H.R. 7213, a bill to amend the Public Health Service Act to enhance activities of the National Institutes of Health with respect to research on autism, spectrum disorder, and
Without
enhanced
objection, the
programs.
first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So order. Does anyone seek to be recognized on the bill?
Madam Chair.
For what purpose does Mr. Latta seek recognition?
Thank you, Madam Chair. I have an amendment at the desk in the nature of a substitute.
The clerk will report.
Amendment in the nature of a substitute to committee print of H.R. 7213.
Without objection, the reading of the amendment is dispensed with. Gentleman's recognized for 5 minutes in support of his amendment.
Thank you much, Madam Chair. I rise in support of the amendment and underlying bill, H.R. 7213, the Autism Collaboration, Accountability, Research, Education, Support Act, or the Autism CARES Act of 2024, led by the gentleman from New Jersey's 4th Congressional District. According to the Centers for Disease Control, over 5.4 million U.S. adults were estimated to have autism spectrum disorder, or ASD, in 2017. This accounts for a 178% increase in the prevalence since 2000. Further, 1 in every 36 children were diagnosed with ASD in 2020. The programs and activities authorized under the Autism CARES Act serve as the primary driver of autism research, services, training, and monitoring across the federal government. This aims makes certain improvements to the current programming, including ensuring the programs are appropriately channeling resources towards the most impactful forms of research and services, as well as coordinating across the various programs at the NIH, CDC, and HRSA. Most importantly, this bill takes steps to ensure the public and all individuals with ASD community have an opportunity to engage in and are included in the research process and other activities related to autism. I'm proud of the work that has been done on this bill and the engagement and communications of the stakeholders throughout this process. I encourage my colleagues to support the aims and the underlying legislation. Thank you, Madam Chair. I yield back the balance of my time.
Gentleman yields back. Further discussion? If there's no further discussion, the vote occurs on, For what purpose does Mr. Carter seek recognition?
Madam Chair, I move to strike last word.
Gentleman's recognized for 5 minutes.
The Autism CARES Act has been the single most important driver of federal investment in autism research and training programs over the past 2 decades. It has led to improvements in early intervention services, a better understanding of the prevalence of autism, and a better understanding of the co-occurring health conditions that autistic people experience. Importantly, it has also been responsible for thousands of future health professionals being trained on how to screen, diagnose, and provide interventions to autistic people and other individuals with neurodevelopment disabilities to improve their health and well-being. Thanks to the Autism CARES Act, many health professionals are better equipped to meet the ever-changing and diverse needs of autistic people and other people with neurodevelopment disabilities. This bill will ensure ongoing support by NIH of research at institutions like the Marcus Autism Center in Atlanta and the Georgia Lynn Program at Georgia State University. Located in my home state of Georgia within Children's Healthcare of Atlanta, the Marcus Autism Center is one of the largest organizations in the country that blends research on autism with providing clinical services for children on the autism spectrum and their families. It is my hope the House will consider this bill as soon as possible so we can work with the Senate to secure passage and enactment into law before the current authorization expires at the end of this fiscal year. Thank you, Madam Chair, and I yield back.
Gentleman yields back. Is there any further discussion? Seeing none, the vote occurs on the amendment. All those in favor will signify by saying aye. Those opposed, nay. The ayes have it. The amendment is agreed to. Question now occurs on approving H.R. 7213 as amended, and a roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Duncan votes aye. Palmer. Dunn. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Kamick. Kamick votes aye. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eshue. Eshue votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. Vesey. Vesey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagon. Blunt Rochester. Soto. Soto votes aye. Craig. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Madam Clerk, has Mr. Palmer recorded?
Mr. Palmer is not recorded. Palmer votes aye. Dunn is not recorded. Dunn votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 42 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 8084 and asks the clerk to report.
H.R. 8084, a bill to amend Title 19 of the Social Security Act to require states to verify certain eligibility criteria.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill?
On the amendment, Madam Chair.
Oh, are there any amendments? Mr. Bilirakis,
Thank you.
for what purpose do you seek recognition?
I have an amendment at the desk.
The clerk will report.
Amendment in the nature of a substitute to H.R. 8084, offered by Mr. Bilirakis. Strike all after the enacting
Without
clause and
objection,
insert
the reading
following.
of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Madam Chair. I want to offer the sains to my bipartisan bill. It's H.R. 8084, the Leveraging Integrity and Verification of Eligibility or Live Beneficiaries Act. I'm grateful to work alongside Representative Craig and thank her for her support. It's a common sense bill, and it's focused on Medicaid program integrity and preventing fraud, waste, and abuse to save tax dollars. The AINS incorporates technical assistance we receive from CMS to ensure that states are certifying, at least on a quarterly basis, that enrollees are not listed on the Social Security Administration's Death Master File database. We also include a provision to give states the ability to check other death records to make sure Medicaid beneficiaries are not deceased. We also require immediate disenrollment of beneficiaries should they verify the death of Medicaid enrollees. This repeals the current CMS guidance that forced states to collect additional information about their beneficiaries to ensure their records are correct. I questioned Director Tsai about this unnecessary bureaucracy, and I'm glad we can address it here with this particular amendment. Lastly, while I know the Death Master file is a highly accurate record of information, sometimes mistakes do occur, and they really do occur, Madam Chair. We have evidence that they do. The amendment importantly provides a process for re-enrollment should the information from the database turn out to be incorrect. We certainly agree that we don't want to inadvertently disenroll Medicaid patients that are still alive, and this amendment makes that clarification. I ask all my colleagues to support my aims and support this common sense proposal by passing ultimately H.R. 8084 as amended. And I'll yield back the balance of my time unless someone wants it. I'll yield back, Madam Chair. Thank you so very much.
Gentleman yields back. For what purpose does Ms. Craig seek recognition?
Madam Chair, I move to strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you so much, Madam Chair. Thank you for holding today's markup and for including my bill, the Live Beneficiaries Act. I also want to thank my colleague, Representative Bilirakis, for his partnership on this common sense piece of legislation. Gus, it's always a pleasure working with you and your team. Our bill would require states to verify through a quarterly check with the Social Security Administration's Death Master File database that Medicaid recipients are not deceased and remove any deceased beneficiaries from their databases. This simple fix will prevent hundreds of millions of dollars in improper payments and make sure that taxpayer dollars are being spent responsibly. When I came to Congress, I promised that I would work across the aisle and seek to reform the way government works. Our bill makes important reforms to the government's oversight of taxpayer dollars. By tackling this kind of waste, we can make room to fund important priorities, like the home and community-based services that so many Medicaid beneficiaries rely on. Thank you again, Madam Chair, and I yield back.
Gentlelady yields back. Further discussion? If there's no further discussion, the vote occurs on the amendment. All those in favor signify by saying aye. All opposed, nay. The ayes have it. The amendment is agreed to. Is there further discussion? Question now occurs on approving H.R. 8084 as amended, and the roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Burgess votes aye. Latta. Aye. Latta votes aye. Guthrie. Aye. Guthrie votes aye. Griffith. Aye. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Hudson. Wahlberg. Wahlberg votes aye. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Aye. Dunn votes aye. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Allen votes aye. Balderson. Balderson votes aye. Fulcher. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamek. Kamek votes aye. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eschew. Eschew votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. Vesey. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Madam Clerk, how is Mr. Palmer recorded?
Mr. Carter is not recorded. Carter votes aye.
Mr. Palmer?
Mr. Palmer is not recorded. Palmer votes aye.
How's Mr. Crenshaw recorded?
Mr. Crenshaw is not recorded. Crenshaw votes aye.
How's Mr. Fulcher recorded?
Mr. Fulcher is not recorded. Fulcher votes aye.
How's Mr. Hudson recorded?
Mr. Hudson is not recorded. Hudson votes aye.
Madam Clerk, is Mr. Vesey recorded?
Mr. Vesey is not recorded. Vesey votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 46 ayes and 0 noes.
Ayes have it. The bill is adopted. Chair calls up H.R. 8089 as amended by the Subcommittee on Health and asks the clerk to report.
H.R. 8089, a bill to amend Title 19 of the Social Security Act to require certain additional provider screening under the Medicaid program.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? For what purpose does Mr. Peters seek recognition?
Madam Chair, I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you. In fiscal year 2023, the Department of Health and Human Services estimated a combined total of over $100 billion in improper payments in Medicare and Medicaid. In April, Comptroller General Eugene Dodaro testified before this committee's Oversight Committee about how better collaboration between CMS and states in provider screening and enrollment would help prevent improper payments. After the hearing, my colleague, Congressman Garcia, and I introduced the Medicare and Medicaid Fraud Prevention Act, which will give states better access to Social Security's death master file so they can confirm doctors are not dead before being automatically re-enrolled. Legislation before us is non-controversial, has bipartisan support. It's not going to stop improper payments overnight, but it is a small step in the right direction. I urge my colleagues to support it, and I yield back.
Gentleman yields back. Further discussion? Question now occurs on approving H.R. 8089 as amended, and the roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Griffith. Griffith votes aye. Bilirakis. Bilirakis votes aye. Bouchon. Hudson. Wahlberg. Wahlberg votes aye. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Lesko. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller-Meeks. Miller-Meeks votes aye. Kamick. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eshue. Eshue votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes.
Aye.
Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. Vesey. Vesey votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye. Guthrie votes aye. Bouchon votes aye. Hudson votes aye. Carter votes aye. Palmer votes aye. Lesko votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 45 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 8111 and asks the clerk to report.
H.R. 8111, a bill to amend Title 19 of the Social Security Act to ensure the reliability of address information provided under the Medicaid program.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill? If there's no further discussion, for what purpose does Mrs. Miller Meeks seek recognition?
Madam Chair, I move to strike the last word.
Gentlelady's recognized for 5 minutes.
My legislation, H.R. 8111, the Medicaid Program Improvement Act, co-led by Congressman Cartwright, would create a process for state Medicaid programs and managed care organizations to obtain address information of program beneficiaries to ensure they are not enrolled in multiple Medicaid programs. This simple good governance legislation would maintain program integrity and help control unnecessary costs to states and the federal government without restricting access to those who legitimately qualify for Medicaid. I thank the committee for moving the bill and urge my colleagues to vote yes on the Ains and the underlying legislation. Thank you, Madam Chair, and I yield back the balance of my time.
Gentlelady yields back. Does the gentlelady, Mrs. Miller Meeks, have an amendment?
I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 8111, offered by Ms. Miller Meeks. Strike all after the enacting clause and insert the following. Section 1, short title. This act may be cited as the Medicaid Program Improvement Act. Section 2, ensuring the reliability of address information provided under the Medicaid program.
Without objection, the reading of the amendment is dispensed with. Gentlelady is recognized for 5 minutes in support of her amendment.
I just urge a yes vote on the Ains and the underlying bill.
There's no further discussion. The vote occurs on the amendment. All those in favor say aye. Aye. Those opposed, nay. The ayes have it. The amendment is agreed to. Is there further discussion? Seeing none, the question now occurs on approving, question occurs on the Ains, right? Was it in the Ains?
We did that by voice vote. Now
By
we're on
vote.
final passage.
Okay, thank you. Question now occurs on approving H.R. 8111 as amended. A roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Griffith. Griffith votes aye. Bilirakis. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Lesko. Lesko votes aye. Pence. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eschew. Eschew votes aye. DeGette. DeGette votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes.
Aye.
Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. VC. VC votes aye. Custer. Custer votes aye. Kelly. Kelly votes aye. Badagan. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye. Palmer votes aye. Bilirakis votes aye. Wahlberg votes aye. Hudson votes aye. Carter votes aye. Allen votes aye. Pence votes aye. Guthrie votes aye.
You're the good students. You're all here in your chairs, voting.
Can you ask her to call the roll of the folks who have not voted? I want to make sure we're not missing anyone. There were a bunch of people around.
Okay. Madam Clerk, would you call the names of those members who have not been recorded on this vote, please?
Rep. Lesko. Armstrong. Pfluger. Kamick. Badagan. Blunt Rochester. Curtis. Lesko votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 46 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 8112, and as amended by the Subcommittee on Health, and asks the clerk to report.
H.R. 8112, a bill to amend Title 19 of the Social Security Act to further require certain additional provider screening under the Medicaid program.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on this bill?
Amendment. I have an amendment.
I'm sorry, who was that?
I have an amendment.
The clerk will report the amendment.
Amendment to committee print of H.R. 8112, offered by Mr. Guthrie. Page and line numbers refer to the
Without
committee.
objection, the reading of the amendment is dispensed with. Gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Madam Chair. H.R. H112 is simple. We should not let bad doctors in the Medicaid program. One way that we try to maintain the integrity of the program is by entering doctors into the Data Exchange, or DEX, which is a database managed by CMS that monitors doctors who have been terminated from the Medicare and Medicaid program. To be clear, doctors are not removed casually from either program. You have to commit fraud or harm patients in order to be terminated from the programs. The issue here is that states are not always actively checking the DEX. If a doctor breaks the law in Ohio or Tennessee and is removed from the state's Medicaid program, the doctor will be entered into the DEX. However, if my home state of Kentucky isn't checking the DEX, we may inadvertently let the doctor practice in our state. The amendment today incorporates technical assistance from CMS that would require monthly screenings for the DEX rather than the initially proposed quarterly screenings to ensure they are diligent in protecting the Medicaid program. This bill is straightforward, and I hope we will all agree that keeping bad doctors out of Medicaid is in everyone's best interest. Thanks, everybody, for all the work on this bill, and I will yield back.
Is there further discussion? Seeing none, the vote occurs on the amendment. All those in favor signify by saying aye.
Aye.
Those opposed, nay. The ayes have it. The amendment is agreed to. Is there further discussion? Question now occurs on approving H.R. 8112 as amended. A roll call vote has been requested. The clerk will call the roll.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bouchon. Bouchon votes aye. Hudson. Wahlberg. Wahlberg votes aye. Carter. Duncan. Duncan votes aye. Palmer. Dunn. Dunn votes aye. Curtis. Lesko. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Allen. Balderson. Balderson votes aye. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller Meeks. Miller Meeks votes aye. Kamick. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eschew. Eschew votes aye. Deget. Deget votes aye. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Clark votes aye. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. Vesey. Vesey votes aye. Custer. Custer votes aye. Kelly. Badagan. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye. Lesko votes aye. Bilirakis votes aye. Hudson votes aye. Carter votes aye. Palmer votes aye. Weber votes aye.
Clerk will report.
Chair Rogers, on that vote, there were 45 ayes and 0 noes.
The ayes have it, and the bill is adopted. Chair calls up H.R. 4758, asks the clerk to report.
H.R. 4758, a bill to amend Title 19 of the Social Security Act to streamline enrollment under the Medicaid program of certain
Without
providers.
objection, the
across-
first reading of the bill is dispensed with. The bill will be open for amendment at any point, so ordered. Does anyone seek to be recognized on the bill?
I have an amendment.
For what purpose does Ms. Trahan seek recognition?
I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 4758. Strike all after the enacting clause and insert
Without
the
objection,
following.
the reading of the amendment is dispensed with. Gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Madam Chair. My amendment makes technical adjustments to this bipartisan bill, which I introduced alongside Congresswoman Miller Meeks. When necessary clinical care is determined for a child by medical professionals, there should be no reason that administrative burdens get in the way. The Accelerating Kids Access to Care Act is designed to cut through red tape and get kids the appropriate care and often life-saving care that they need. To express the importance of getting this legislation over the finish line, I'd like to highlight a story from a patient who was negatively impacted by the burdensome and time-consuming Medicaid provider screening and enrollment process. Almost 3 years ago, a baby, and I'll call her Lily, was born in a rural state with her esophagus in 2 separate segments and connected abnormally to the windpipe. Because this condition requires a particularly complicated procedure to correct it, doctors explained to the family there are only 2 places in the country where it could be done. One of them was Boston Children's Hospital in my home state of Massachusetts. Immediately, Lily and her parents were ready to travel to Boston, where the surgeons were standing by to perform the life-saving operation. But instead, Lily, who is a Medicaid recipient, was waiting for her home state to enroll the 8 providers at Boston Children's who needed to perform this complex surgery. Her state, confused about the rules concerning out-of-state provider enrollment, wouldn't authorize the services provided by Boston Children's. Lily's surgery was rescheduled more than 3 times and delayed over 7 months. As Lily waited, she lived with a floppy airway that could have collapsed at any moment, a weakened immune system, and routine breathing difficulties. This situation was not just a delay in paperwork, it was a delay that put a child's life at significant risk. Every day that passed was a day where her condition could have taken a fatal turn, and Lily's story is one of many across our country. That's why it is crucial for us to pass the Accelerating Kids Access to Care Act. The stakes are simply too high to allow bureaucratic hurdles to stand in the way of urgent medical care for our most vulnerable children. When care is delayed for kids with complex medical issues who need to cross over state lines, the consequences are severe and far-reaching. Delays in accessing appropriate care can lead to increased mortality rates and worsened health outcomes for pediatric patients. Additionally, families face significant financial and psychological strain when care is delayed. These delays also contribute to increased use of emergency services and high overall health care costs. I want to thank my colleague, Congresswoman Miller Meeks, for working with me on this important legislation, and I strongly urge my colleagues on this committee to support the Accelerating Kids Access to Care Act today so that we can ensure that no child on Medicaid has to endure unnecessary delays in receiving critical medical care across state lines. Thank you, Madam Chair. I yield back.
Gentlelady yields back. For what purpose does Mr. Carter seek recognition?
Madam Chair, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Madam Chair, I'd like to express my support for the Accelerating Kids Access to Care Act, which will help families access life-saving care for children with complex medical conditions. In Georgia, we are blessed to have world-class children's hospitals that care for kids across the country. However, in some cases, patients with rare and complex diseases have to travel out of state to receive specialized care when the services they need are not available in their own state. The process is difficult, and it's full of red tape, often delaying children and their families from receiving the care they desperately need, and in some cases, blocking access to care altogether. The Accelerating Kids Access to Care Act will allow states to streamline the process for out-of-state pediatric care providers to enroll in another state's Medicaid program while also providing important guardrails. This is common sense policy that will help children with complex medical conditions access critical care. I'm also pleased to see the bipartisan amendment include crucial pharmacy benefit manager reforms from my Drug Price Transparency and Medicaid Act. This provision would prohibit spread pricing in Medicaid and clarify that states should reimburse PBMs contracting with Medicaid managed care organizations for an administrative fee for managing the pharmacy benefit for Medicaid beneficiaries. This will save taxpayers roughly $300 million and will protect patients, pharmacies, and others from middleman tactics that drive up prescription drug costs. I commend Dr. Miller Meeks and Representative Trahan for working on this issue, and I urge my colleagues to support the Accelerating Kids Access to Care Act. Thank you, Madam Chair, and I yield back.
Gentleman yields back for further discussion. Chair, for what purpose does Ms. Eshu seek recognition?
Move to strike the last word, Madam Chairwoman.
Gentlelady is recognized for 5 minutes.
Thank you. I rise to speak in support of this bill, and I want to thank Representatives Trahan and Miller Meeks for leading on this important effort to ensure children in need of life-saving care can receive it. Today, when a child with cancer, a rare disease, or much-needed surgery needs to travel to another state to receive treatment, the physician and sometimes the entire healthcare team treating the child must be screened and enrolled in the child's home state Medicaid program. This is a highly, as other members have stated, this is a highly burdensome process. It's filled with red tape for physicians, and it delays the life-saving care for children who really can't afford to wait. I've seen this happen over and over again because I have the Lucille Packard Children's Hospital in the heart of my district. This legislation fixes exactly what the title of the bill says by creating a voluntary and streamlined process to allow physicians to enroll in another state's Medicaid program. So I fully support this effort. I thank the members that are leading it, and I think it deserves a unanimous vote so it can become law this year. And with that, Madam Chairwoman, I yield back.
Gentlelady yields back. For what purpose does Mr. Hudson seek recognition?
Speak on the bill.
Gentleman is recognized for 5 minutes.
Thank you. I'm so glad to see this bill come forth. It directly impacts thousands of children and their access to needed out-of-state care. I want to put a face on this, though. I want to tell you a story of a 2-year-old boy named Gabe from Texas. He was finally medically stable enough to make the wait list for a thymus transplant at Duke Children's Hospital and Health Center just outside my district. The surgeons at Duke are some of the only people in the country that can provide this surgery. Yet Texas Medicaid decided it wasn't medically necessary for him to have this transplant. I can't imagine the anger, the frustration, the stress I would feel as a father in that situation. Gabe had to fight for his life every day because his family can't receive a timely approval like others who have private insurance. Life expectancy of the form of DeGeorge syndrome he has is typically 2 or 3 years. When Gabe was 4, they found another path with Duke coordinators transporting them up to North Carolina again, only to have to turn around and go back to Texas because of technical tax codes changing. After years of disappointments, months in the hospital, the hardships Gabe's parents and siblings had to face, and the sadness of living the opposite of a normal childhood, Gabe finally got the transplant at Duke that he needed. This bill will save thousands of kids and families from going through the same struggles and hurdles that Gabe's family did. I look forward to voting in favor of this bill. With that, I yield back.
Gentleman yields back for the discussion. For what purpose does Ms. Castor seek recognition?
Strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you, Madam Chair. I want to thank Representatives Trahan and Miller Meeks for bringing the Accelerating Kids Access to Care Act. This is a very important next step on the bipartisan work the Energy and Commerce Committee has done over the years. In 2019, the committee passed the ACE Kids Act. It was a bill I led with Congressman Bill Arakis and Rep. Eshoo and Congresswoman Herrera Butler. As you all know, the Medicaid is the largest insurer of children in the United States, especially for children with complex medical conditions or cancer or a rare disease. And children with complex medical conditions often need specialized treatment that is not available in their community or in their state. So the ACE Kids Act created a new state option under Medicaid that, in conjunction with our children's hospitals, that would creates medical homes in those children's hospitals, and it allows children to cross state lines to get the care they need. The goal of that effort was to put kids with complex medical conditions and their families first. And now, by allowing these states to implement these medical homes through Medicaid that coordinate care, they lower costs, they save time for families and providers. Now, the Accelerating Kids Access to Care Act is the important next step that needs to happen to make it easier for qualified pediatric providers to enroll in multiple Medicaid programs. The bill is going to make it easier for families. I think about the fantastic children's hospitals in the Sunshine State, too, in the Tampa Bay area, Johns Hopkins All Children's, and then St. Joseph's Children's Hospital. Sometimes they will have the providers that can serve the needs of a child in Georgia or in South Carolina. We shouldn't be so stringent under the Medicaid laws that a child with a complex medical condition cannot get the care they need and see the specialists that they need. Overall, this is a godsend to families. I'm proud to be a co-sponsor, and I look forward to voting yes today. I hope everyone will vote yes. Thank you.
Gentlelady yields back. For what purpose does Mrs. Miller Meeks seek recognition?
Madam Chair, I move to strike the last word and speak in favor of the bill.
Gentlelady is recognized for 5 minutes.
Thank you, Madam Chair. I'm proud to lead the Accelerating Kids Access to Care Act with my colleague, Representative Lori Trahan. This legislation would streamline administrative processes for providers who need to enroll in another state's Medicaid program due to a lack of services provided in a patient's home state. I was also proud to have a fellow Iowan and constituent, Dr. Alec Basuk, testify before the committee in February to support the legislation and highlight the positive impact it would have on Iowa families. There is currently no standardized federal pathway for this process, meaning that providers must enroll in each individual state's Medicaid program whenever they see a patient from that state and must maintain regular paperwork to remain enrolled in each state's Medicaid program. When a child from a different state is visiting a doctor, as may be the case if a child is from another state, travels to Iowa for care, which given that we're less than an hour away from places in Illinois and Missouri, there are often delays in care as the providers must sift through weeks of paperwork, risking the health of children with critical life-threatening conditions. I would also like to thank Congressman Buddy Carter for advocating for a ban on spread pricing in Medicaid, which saves the program $300 million and is the pay-for this policy. Again, I'm proud to see this committee move this critical piece of legislation. I applaud the committee and the chair for bringing forth this legislation, and I encourage my colleagues to vote yes on the AINS and on the underlying bill. I yield back to
Will the gentlelady
balance.
yield?
Yes.
Thank you. I just wanted to point out, Madam Chairwoman, that this is a fine moment in the legislation going on in the United States Congress. We have a newer member on this committee, Democrat, and another newer member on this committee, a Republican, working together, and you heard the examples of the difficulties and the unfortunate life-risking situation of not correcting our system. And this bill will be practical, it will be responsible, and it's something that is long, long overdue. What's unfortunate is that this fine piece of legislation and this cooperation and this coming together to do the right thing will probably not be on television tonight. It will probably not make tweets, et cetera, et cetera. So the American people will probably not even hear about it or know about it. And on top of that, we have many bills today that are going through this committee unanimously, with every Republican and Democrat speaking positively about the cooperation with each other and the work that the staff and all of us have been doing for many, many years in some cases to finally culminate in good, positive legislation for the American people. So I just wanted to point out this fine, fine moment of this incredible committee and these incredible members who have come together to do the right thing. So and also one more thing that I want to point out. Yes, it's not lost on me that the two leads on this are both women. Thank you very much, and I yield back.
Thank you, Representative
Gentlelady
Cardenas.
yield.
I yield back.
Gentlelady
Yes, I'll
yields
yield.
back.
Madam Chair, I'd like to associate myself with the remarks of Mr. Cardenas. Thank you. Now yield back.
Thank you, Representative Carter. I yield back the balance of my time.
Gentlelady yields back. Is there further discussion? Okay. There's no further discussion. The vote occurs on the Trahan-Ains amendment. All those in favor signify by saying aye.
Aye.
All those opposed, nay. The ayes have it. The amendment is agreed to. Question now occurs on adopting H.R. 4758 as amended, and a roll call vote has been requested. The clerk will call the vote.
Burgess. Burgess votes aye. Latta. Latta votes aye. Guthrie. Guthrie votes aye. Griffith. Griffith votes aye. Bilirakis. Bouchon. Bouchon votes aye. Hudson. Hudson votes aye. Wahlberg. Wahlberg votes aye. Carter. Carter votes aye. Duncan. Palmer. Duncan votes aye. Dunn. Dunn votes aye. Curtis. Lesko. Lesko votes aye. Pence. Pence votes aye. Crenshaw. Crenshaw votes aye. Joyce. Joyce votes aye. Armstrong. Weber. Weber votes aye. Allen. Balderson. Fulcher. Fulcher votes aye. Pfluger. Harshbarger. Harshbarger votes aye. Miller-Meeks. Miller-Meeks votes aye. Kamick. Obernolte. Obernolte votes aye. James. James votes aye. Pallone.
Aye.
Pallone votes aye. Eshue. Eshue votes aye. DeGette. Schakowsky. Schakowsky votes aye. Matsui. Matsui votes aye. Castor. Castor votes aye. Sarbanes. Sarbanes votes aye. Tonko.
Aye.
Tonko votes aye. Clark. Cardenas. Cardenas votes aye. Ruiz. Ruiz votes aye. Peters. Peters votes aye. Dingle. Dingle votes aye. Vesey. Custer. Custer votes aye. Kelly. Kelly votes aye. Barragan. Blunt Rochester. Soto. Soto votes aye. Craig. Craig votes aye. Schreier. Schreier votes aye. Trahan. Trahan votes aye. Fletcher. Fletcher votes aye. Chair Rogers.
Aye.
Chair Rogers votes aye.
Madam Clerk, how is Mr. Palmer recorded?
Mr. Palmer is not recorded. Palmer votes aye.
How is Mr. Allen recorded?
Allen votes aye.
How is Mr. Balderson recorded?
Mr. Balderson is not recorded. Balderson votes aye.
The clerk will report.